Hello everyone and welcome to today's Brace Bites, which is about DIY braces and what you need to know about them. So for those of you that might be aware, DIY braces or direct-to-consumer braces, which are often aligners, are a growing market that you might have seen on social media, you might have seen them advertising on TV. And the reason we're talking about it today really is because for some time now there has been some concern over certain direct-to-consumer providers and certain areas where orthodontists and dentists as a profession feel like there are maybe some gaps in what needs to happen for an ideal outcome and safe patient treatment. And we are delighted that just this month, the General Dental Council, who are the regulatory body for dentistry in this country, have released a statement about what needs to happen for direct-to-consumer aligners, for DIY braces to be safe and for them to be treated appropriately and ethically. And so you can find all this information on the General Dental Council website. So that is available for the public to see. And if you are thinking about getting DIY braces, direct-to-consumer aligners, it is something that is worth thinking about. So what do we mean when we talk about DIY braces? So DIY braces is when people often get sent an impression set, so some moulds in the post that they take and then they then send off and somebody looks at them and comes up with a plan for your treatment. Now, the first, the GDC have released 3 important things that they think need to happen as part of your treatment. And the first thing is that you should have a dental checkup, a direct clinical assessment to check that your teeth, your bone, your gums are healthy enough for the treatment. So that involves you going to a clinician, being seen directly, not remotely, to have x-rays, to have a clinical assessment so that you can ascertain that your teeth are healthy, your gums are healthy, your bone is healthy to support the treatment. So there are not going to be any detrimental health benefits to that treatment. It also suggests that you need to have direct interaction with a clinician of some sort. So that means you need to speak to somebody who is capable and experienced enough to provide that treatment for you, so that they can tell you not only about the benefits of the treatment, but inform you of any risks that there might be to treatment. And there are some generic risks, but there are also some risks that are very personal to you, because once we, for example, have had a look at your x-rays or had a look at your mouth, there are certain teeth or certain areas of your mouth that need to have special attention. And so somebody needs to have that discussion with you so that when you decide to go ahead with the treatment, you know what the risks and benefits are for the treatment specifically for you, not just the general risks and benefits of orthodontic treatment. And then the third thing that the GDC talk about is that during your treatment, you should be able to have direct access and contact to the person that is providing your treatment for you. So that means it's not just a one-off thing that at the beginning of the treatment, you have access to a professional and then you just send all your aligners and you just get on with it yourself. It means that throughout your treatment, you have a contact point for a named person that you know that you can go to should you have any questions about your treatment. And this way, this ensures that your treatment is safe and it is done with your best interests at heart. So that's a little bit of information about DIY braces. For more information, like I said, you can go to the General Dental Council website. The British Orthodontic Society have also made a statement about this. And so what we're really saying is that if you're going to see somebody for DIY braces, make sure that you see somebody who's qualified to do that. Make sure that you see somebody who has done a direct clinical check for you. Make sure you see somebody who has had the time to explain the pros and cons of treatment for you. And make sure that you have somebody who is holding your hand throughout your treatment journey so that you know you get to that safe and effective endpoint. Any more questions? You know where we are. Have a great time. Bye-bye.